Question 1. A licensed practical nurse, LPN, is caring for a client with heart failure who reports a sudden increase in shortness of breath and has Crackel's bilateral lung bases. The client's oxygen saturation is 88% on room air. What is the LPN's priority action? A. Administer ordered furosemide. B. Elevate the head of the bed. C. Notify the registered nurse, RN, or healthcare provider. D. Apply oxygen via nasal cannula. Answer: D. Apply oxygen via nasal cannula. This question tests the concept of prioritizing interventions in an acute respiratory distress scenario, emphasizing immediate life-saving actions. The keywords sudden increase in shortness of breath, Crackel's bilateral lung bases, and oxygen saturation is 88% indicate acute respiratory compromise requiring immediate intervention. Applying oxygen is the priority because it directly addresses the client's hypoxemia, a life-threatening condition, stabilizing them before other actions like medication administration or notification. For example, if someone is drowning, the first step is to get them air. Similarly, for a client with low oxygen, giving oxygen is paramount. Always remember to address the immediate threat to life, like airway and breathing, before anything else. Question 2. The LPN is reinforcing discharge teaching for a client with a new prescription for warfarin. Which statement by the client indicates an understanding of the teaching? A. I should eat more green leafy vegetables to boost my vitamin K intake. B. I will take my medication at the same time every day. C. I can stop taking this medication once my leg swelling goes down. D. I will avoid using a soft bristle toothbrush to prevent gum bleeding. Answer: B. I will take my medication at the same time every day. This question assesses the LPN's role in reinforcing medication teaching, specifically for anticoagulants like warfarin, and the importance of medication adherence. The keyword understanding of the teaching prompts the nurse to identify the correct statement from the client. Warfarin levels can fluctuate based on diet, so increasing green leafy vegetables would be incorrect as they contain vitamin K, which counteracts warfarin. Avoiding a soft bristle toothbrush is also incorrect as it promotes gum bleeding, and stopping the medication without a provider's order is unsafe. Taking warfarin at the same time daily ensures consistent therapeutic levels, which is crucial for safety and effectiveness. Just like taking birth control pills, consistency is key for medications that require steady levels in your body. Remember, consistency is vital for medications with a narrow therapeutic range like warfarin. Question 3. An LPN is performing wound care for a client with a pressure injury. The wound bed is red and moist with new granulation tissue. Which dressing choice is most appropriate for this type of wound? A. Dry gauze dressing. B. Wet to dry dressing. C. Hydrocolloid dressing. D. Povidone iodine-soaked gauze. Answer: C. Hydrocolloid dressing. This question evaluates the LPN's knowledge of appropriate wound care principles, specifically for a healing wound. The keywords red and moist with new granulation tissue indicate a healthy, clean wound bed that needs a moist environment to continue healing, not drying out. A dry gauze dressing would absorb moisture and potentially disrupt new tissue. Wet to dry dressings are generally for debridement of necrotic tissue, and povidone iodine is often too harsh for clean wounds. A hydrocolloid dressing provides a moist, occlusive environment that supports granulation and epithelialization, protecting the delicate new tissue. Think of it like a protective bandage that keeps the healing skin damp and safe, allowing it to grow back without drying out. The key is to support the wound's natural healing process by maintaining an optimal moist environment. Question 4. An LPN is assisting with the care of a client with Clostridium difficile infection. Which personal protective equipment, PPE, should the LPN don before entering the client's room? A. Gown and gloves. B. Mask and goggles. C. N95 respirator and gown. D. Gown, gloves, and N95 respirator. Answer: A. Gown and gloves. This question tests the LPN's knowledge of infection control, specifically contact precautions required for Clostridium difficile, C. diff. The keyword Clostridium difficile infection immediately signals that contact precautions are necessary because C. diff is transmitted via the fecal-oral route. Contact precautions mandate the use of a gown and gloves to prevent skin and clothing contamination when interacting with the client or their environment. A mask, goggles, or N95 respirator are typically not required for standard C. diff care unless aerosol-generating procedures are performed. It's like putting on an apron and gloves when you're handling something messy to protect yourself and prevent spreading it. Always remember to wash your hands with soap and water after caring for a C. diff client, as alcohol-based hand rub is not effective against its spores. Question 5. A client with type 2 diabetes asks the LPN, "Why do I need to check my feet every day?" What is the best response by the LPN? A. It helps us track your progress in managing your blood sugar. B. Daily foot checks help prevent complications like nerve damage and infections. C. It's important for detecting early signs of kidney problems. D. You need to report any calluses or corns so they can be removed promptly. Answer: B. Daily foot checks help prevent complications like nerve damage and infections. This question assesses the LPN's understanding of patient education regarding diabetes management and preventive care. The keyword best response directs the nurse to select the most comprehensive and relevant answer for daily foot checks in a diabetic client. Diabetes can cause peripheral neuropathy, nerve damage, and poor circulation, leading to reduced sensation and impaired healing in the feet, making them highly susceptible to unnoticed injuries, infections, and eventually amputations. Daily checks help identify cuts, blisters, redness, or swelling early, allowing for timely intervention. It's like checking your car's tires daily for punctures before they lead to a flat. Emphasize that prevention is key in diabetes foot care. Question 6. The LPN is preparing to administer an intramuscular injection to an adult client. Which needle gauge and length are generally most appropriate for this procedure? A. 25 gauge, 5/8 inch. B. 22 gauge, 1 inch. C. 18 gauge, 1.5 inch. D. 20 gauge, 2 inches. Answer: B. 22 gauge, 1 inch. This question tests the LPN's practical knowledge of safe medication administration, specifically needle selection for intramuscular, IM, injections. The concept is choosing the correct needle for the site and medication type. For most adult IM injections, a 22 gauge, 1 inch needle is commonly appropriate, as it is long enough to reach the muscle tissue in many adult clients and has a lumen wide enough for most medications without being too large to cause excessive pain. A 25 gauge, 5/8 inches typically for subcutaneous injections, while 18 gauge or 20 gauge, 1.5 to 2 inches are often used for thicker medications, larger muscles, or obese clients. Always select the smallest gauge and shortest length needle that can safely deliver the medication to the correct tissue depth. Question 7. A client with newly diagnosed hypertension is prescribed a low-sodium diet. Which food item, if chosen by the client, indicates a need for further teaching by the LPN? A. Fresh baked chicken breast. B. Canned soup. C. Plain oatmeal. D. Steamed green beans. Answer: B. Canned soup. This question evaluates the LPN's ability to assess a client's understanding of dietary restrictions, specifically a low-sodium diet. The keyword "need for further teaching" indicates the nurse should identify the incorrect choice. Fresh chicken, plain oatmeal, and steamed green beans are generally low in sodium. Canned soups, however, are notoriously high in sodium, often containing hundreds of milligrams per serving, making them unsuitable for a low-sodium diet. It's like choosing a sugary soda when you're supposed to be watching your sugar intake. Always remember to check food labels for sodium content, especially for processed and pre-packaged foods. Question 8. An LPN is providing care for a client who is receiving continuous enteral nutrition via a gastrostomy tube. The LPN notes that the client has developed diarrhea. What is the first action the LPN should take? A. Administer an ordered antidiarrheal medication. B. Notify the registered nurse, RN, or healthcare provider. C. Check the formula's expiration date and infusion rate. D. Obtain a stool sample for culture and sensitivity. Answer: C. Check the formula's expiration date and infusion rate. This question assesses the LPN's critical thinking and problem-solving skills in managing a common complication of enteral nutrition. The keywords "first action" indicate the need for an immediate, independent assessment step. While notifying the RN and obtaining a stool sample are important, the LPN's initial independent action should focus on identifying common, modifiable causes. Diarrhea with enteral feedings is often related to formula issues, expired, too cold, contamination, or the infusion rate being too fast. Therefore, checking the formula's expiration date and the current infusion rate is the most logical first step to rule out these immediate causes before escalating to other interventions. It's like checking if your phone is plugged in before calling technical support when it won't turn on. Prioritize identifying the simplest, most common causes first. Question 9. An LPN is assisting an older adult client who is experiencing orthostatic hypotension. The client is currently lying in bed and needs to get up to use the restroom. What is the safest approach for the LPN to assist this client? A. Assist the client to stand quickly and walk to the restroom to minimize time upright. B. Have the client sit on the edge of the bed for a few minutes before standing, then stand slowly. C. Ask the client to push themselves up to a standing position to build strength. D. Support the client's arms and immediately begin walking them to the restroom. Answer: B. Have the client sit on the edge of the bed for a few minutes before standing, then stand slowly. This question tests the LPN's understanding of fall prevention and safe ambulation techniques for clients with orthostatic hypotension. The keywords orthostatic hypotension and safest approach are critical clues. Orthostatic hypotension is a sudden drop in blood pressure when moving from a lying to a sitting or standing position, which can cause dizziness and increase fall risk. Having the client sit on the edge of the bed for a few minutes allows their blood pressure to adjust to the upright position, reducing dizziness before standing. Rushing the process or having them stand too quickly increases the risk of falls. Think of it like slowly rising from a hot bath to avoid feeling lightheaded. Gradual position changes are crucial for clients prone to orthostatic hypotension. Question 10. The LPN is reinforcing teaching about insulin administration to a client with type 1 diabetes. The client states, "I usually inject my insulin into my arm because it's easier." Which instruction should the LPN provide regarding insulin injection sites? A. It is fine to use your arm as long as you rotate sites within the arm. B. The abdomen is the preferred site for insulin injection due to consistent absorption. C. You should always inject insulin into your thigh, as it has the slowest absorption rate. D. You should only inject insulin into the deltoid muscle for best absorption. Answer: B. The abdomen is the preferred site for insulin injection due to consistent absorption. This question assesses the LPN's knowledge of proper insulin administration techniques, focusing on injection site selection. While multiple sites are acceptable, the keyword consistent absorption points to the abdomen as the best general recommendation. The abdomen generally offers the most consistent and fastest absorption rate for insulin because it has a good subcutaneous fat layer and consistent blood supply. It's important to rotate sites within one area, like the abdomen, to prevent lipodystrophy, fat deposits or indentations, but also to rotate between different anatomical areas, abdomen, thigh, arm, for optimal absorption. Think of it like planting seeds in different spots in a garden to ensure they all get adequate nutrients and grow well. Emphasize that consistent absorption helps maintain steady blood glucose levels. Question 11. An LPN is contributing to the plan of care for a client admitted with acute pancreatitis. Which dietary modification should the LPN anticipate for this client during the acute phase? A. High-protein, low-fat diet. B. Clear liquid diet advancing as tolerated. C. NPO, nothing by mouth. D. Regular diet with small, frequent meals. Answer: C. NPO, nothing by mouth. This question tests the LPN's understanding of acute pancreatitis management and the rationale behind dietary restrictions. The keyword acute phase is crucial. During acute pancreatitis, the pancreas is inflamed, and any food intake stimulates the pancreas to produce digestive enzymes, which can worsen the inflammation and pain. Therefore, the priority is to keep the pancreas at rest, which is achieved by making the client NPO, nothing by mouth, to prevent pancreatic stimulation. This period allows the pancreas to heal and inflammation to subside. It's like putting a broken leg in a cast to allow it to heal without disturbance. Restricting oral intake is fundamental to initial pancreatitis management. Question 12. The LPN is reinforcing teaching for a client newly prescribed sildenafil, Viagra. Which client statement indicates a need for further instruction? A. I should take this medication about an hour before sexual activity. B. I should avoid grapefruit juice while taking this medication. C. I can take this medication daily to maintain an erection. D. I need to call my doctor immediately if I experience chest pain. Answer: C. I can take this medication daily to maintain an erection. This question assesses the LPN's ability to identify misunderstandings in medication teaching, specifically for sildenafil. The keyword need for further instruction prompts the nurse to find the incorrect statement. Sildenafil is typically prescribed for on-demand use, usually about 30 minutes to an hour before sexual activity, and is not meant for daily maintenance of an erection in most cases. Taking it daily could lead to adverse effects and is not the standard therapeutic approach. Avoiding grapefruit juice is correct as it can increase drug levels, and immediate medical attention for chest pain is critical due to potential cardiovascular risks, especially if nitrates are used concurrently. Think of it like taking an antacid only when you have heartburn, not every day for no reason. Sildenafil is generally not a daily medication. Question 13. An LPN is assisting with the care of a client with a history of alcohol use disorder who is experiencing acute alcohol withdrawal. The client is agitated, tachycardic, and reports seeing bugs crawling on the walls. Which medication should the LPN anticipate administering first, if available and ordered? A. Haloperidol. B. Lorazepam. C. Thiamine. D. Naltrexone. Answer: B. Lorazepam. This question evaluates the LPN's knowledge of immediate interventions for acute alcohol withdrawal syndrome. The keywords agitated, tachycardic, reports seeing bugs crawling on the walls describe classic symptoms of alcohol withdrawal, including hallucinations and sympathetic hyperactivity, which can progress to seizures and delirium tremens. Benzodiazepines, like lorazepam, are the first-line treatment to manage these symptoms, reduce agitation, prevent seizures, and stabilize vital signs by calming the overactive central nervous system. Haloperidol is an antipsychotic that might be used for severe hallucinations but typically after benzodiazepines are initiated. Thiamine is important for preventing Wernicke-Korsakoff syndrome but not the immediate acute withdrawal symptoms, and naltrexone is for long-term sobriety. Administering a benzodiazepine promptly is like hitting the brakes on an out-of-control vehicle to prevent a crash. Benzodiazepines are crucial for acute alcohol withdrawal management. Question 14. An LPN is monitoring a client who underwent a thyroidectomy 24 hours ago. Which finding requires immediate intervention by the LPN? A. Client reports mild neck discomfort. B. Heart rate of 88 bpm. C. Client's voice is hoarse. D. Frequent swallowing and noisy breathing. Answer: D. Frequent swallowing and noisy breathing. This question tests the LPN's ability to recognize critical postoperative complications following a thyroidectomy. The keywords immediate intervention signal a life-threatening or rapidly escalating issue. Frequent swallowing combined with noisy breathing, stridor, can indicate laryngeal edema, swelling of the voice box, or hematoma, blood collection, formation near the surgical site, which could rapidly lead to airway obstruction. Mild neck discomfort and hoarseness are common post-thyroidectomy but do not signify immediate airway compromise. A heart rate of 88 bpm is within normal limits. Airway compromise is always the highest priority in nursing. It's like seeing smoke in a building, you act on the potential fire immediately. Always prioritize airway issues. Question 15. The LPN is assisting with the care of a client with a new colostomy. The client expresses anxiety about learning to manage the colostomy at home. What is the most appropriate initial action for the LPN to take? A. Provide the client with detailed written instructions on colostomy care. B. Reassure the client that managing a colostomy is easy and they will learn quickly. C. Assess the client's current understanding and specific concerns about colostomy care. D. Demonstrate the colostomy bag emptying procedure and have the client practice. Answer: C. Assess the client's current understanding and specific concerns about colostomy care. This question evaluates the LPN's role in client education, particularly when facing a new and anxiety-provoking situation. The keywords anxiety and most appropriate initial action indicate the need for a client-centered approach. Before providing any teaching or demonstrations, it's crucial to first assess what the client already knows, what specific worries they have, and their readiness to learn. This assessment guides the LPN in tailoring the teaching plan to meet the client's individual needs and address their anxieties effectively, making the teaching more impactful. Think of it like a teacher first asking students what they already know about a topic before starting a new lesson. Start with assessment to personalize your approach. Question 16. An LPN is reinforcing teaching to a group of older adults about influenza vaccination. Which statement by an attendee indicates a correct understanding of why annual vaccination is recommended? A. The flu shot gives you a mild form of the flu, so you become immune. B. Influenza viruses change every year, so a new vaccine is needed. C. Once you get the flu, you're immune for life, so the vaccine just boosts that immunity. D. The vaccine prevents all types of respiratory infections, not just the flu. Answer: B. Influenza viruses change every year, so a new vaccine is needed. This question assesses the LPN's knowledge of the rationale behind annual influenza vaccination. The keyword correct understanding requires identifying the accurate reason. The influenza virus constantly mutates, leading to new strains emerging each year. Therefore, the vaccine needs to be updated annually to target the strains predicted to be most prevalent in the upcoming flu season. The vaccine does not give you the flu, it doesn't prevent all respiratory infections, and immunity from natural infection is not lifelong. It's like updating your antivirus software every year because new computer viruses are always being developed. New strains require new protection. Question 17. The LPN is caring for a client who is NPO and receiving intravenous fluids at 125 milliliters per hour. The client's morning lab results show a potassium level of 2.8 milliequivalent/L. What is the LPN's best action? A. Discontinue the current 4 fluids and start normal saline. B. Administer a rapid 4 bolus of potassium chloride. C. Notify the registered nurse, RN, or healthcare provider immediately. D. Document the finding and continue to monitor the client. Answer: C. Notify the registered nurse, RN, or healthcare provider immediately. This question tests the LPN's ability to recognize and prioritize critical lab values and the need for collaboration. The keyword best action focuses on the most appropriate professional response. A potassium level of 2.8 milliequivalent/L is significantly low, hypokalemia, and can lead to dangerous cardiac dysrhythmias. While LPNs monitor clients and administer medications, they do not independently change 4 fluids or administer rapid potassium boluses, which are high-risk interventions requiring a physician's order and often RN supervision due to the danger of rapid administration. Therefore, the LPN's priority is to immediately notify the RN or healthcare provider to ensure prompt medical intervention for this critical imbalance. Think of it like identifying a major malfunction in an engine. You immediately inform the mechanic rather than trying to fix it yourself. Recognize critical findings and escalate appropriately. Question 18. An LPN is providing care for a client with a nasogastric (NG) tube connected to low intermittent suction. The client complains of abdominal cramping and nausea. What is the first action the LPN should take? A. Administer an ordered antiemetic. B. Reposition the client to the left side. C. Check the patency of the NG tube. D. Increase the suction setting to relieve pressure. Answer: C. Check the patency of the NG tube. This question assesses the LPN's problem-solving skills for a client with an NG tube experiencing symptoms of obstruction. The keywords abdominal cramping and nausea suggest the NG tube might not be draining effectively, leading to gastric distension. The first action should be to assess the tube's function. Checking the patency of the NG tube, e.g., by checking for kinks, assessing suction, or attempting a gentle flush with saline if policy allows, directly addresses the most common cause of these symptoms, a blocked or improperly functioning tube. Administering an antiemetic might mask the problem, repositioning might not solve an obstruction, and increasing suction could worsen irritation if the tube is blocked. It's like checking if a drain is clogged when water isn't flowing. Always ensure the tube is working properly before other interventions. Question 19. An LPN is reinforcing teaching to a client with chronic obstructive pulmonary disease, COPD, about conserving energy during daily activities. Which statement indicates the client understands the teaching? A. I should try to do all my morning chores at once to get them over with. B. I will use a rolling walker when I go for my daily walks. C. I should breathe quickly and shallowly to get more air. D. I will avoid walking as much as possible to save my energy. Answer: B. I will use a rolling walker when I go for my daily walks. This question evaluates the LPN's ability to assess a client's understanding of energy conservation techniques for COPD. The keyword understands the teaching prompts the nurse to identify the correct application of the principle. Using a rolling walker helps conserve energy by providing support and a place to rest during ambulation, reducing the workload on the respiratory system. Doing chores all at once, breathing quickly and shallowly, which is ineffective for COPD, and avoiding walking altogether are incorrect and counterproductive to energy conservation and overall well-being. Think of it like using a shopping cart at the grocery store instead of carrying everything. It makes tasks easier and less tiring. Energy conservation means pacing activities and using assistive devices when helpful. Question 20. The LPN is contributing to the care plan for a client admitted with a urinary tract infection, UTI. The client reports burning upon urination and frequent urges to urinate. Which goal is most appropriate for this client? A. Client will have clear urine by discharge. B. Client will report pain level of 0/10 within 24 hours. C. Client will verbalize understanding of antibiotic regimen by end of shift. D. Client will report reduction in dysuria and urgency within 48 hours. Answer: D. Client will report reduction in dysuria and urgency within 48 hours. This question assesses the LPN's ability to identify a realistic and measurable client goal for a common condition like a UTI. The keywords most appropriate goal require selecting one that is specific, measurable, achievable, relevant, and time-bound, SMART. While all options relate to UTI care, the most direct and realistic goal focuses on the primary symptoms. Dysuria, burning urination, and urgency are characteristic UTI symptoms, and a reduction within 48 hours is a reasonable expectation with antibiotic treatment. Complete pain relief within 24 hours or clear urine by discharge might be overly optimistic, and understanding medication is an intervention, not a direct outcome goal of symptom resolution. Setting achievable goals helps track progress effectively. Question 21. An LPN is reinforcing teaching to the parent of an infant with gastroesophageal reflux, GER. Which instruction is most important for the LPN to emphasize to the parent? A. Ensure the infant sleeps on their stomach to prevent reflux. B. Feed the infant larger volumes less frequently to reduce stomach emptying. C. Burp the infant frequently during and after feedings. D. Mix rice cereal into the formula to thicken it, even if not recommended by the provider. Answer: C. Burp the infant frequently during and after feedings. This question tests the LPN's knowledge of nursing interventions for infant GER. The keyword most important requires identifying the highest priority. Frequent burping during and after feedings helps to remove swallowed air from the infant's stomach, which reduces stomach distension and the likelihood of reflux episodes and spitting up. Placing an infant on their stomach for sleep increases the risk of sudden infant death syndrome, SIDS, and is contraindicated. Larger, less frequent feedings are likely to worsen reflux. Mixing cereal into formula without a provider's guidance is unsafe and can lead to aspiration or nutritional imbalances. Think of it like releasing air from a balloon gradually to prevent it from bursting. Reducing stomach pressure is key in GER. Question 22. An LPN is providing wound care for a client with a deep, tunneling wound. Which dressing material should the LPN anticipate using to pack the wound? A. Non-adherent gauze. B. Transparent film dressing. C. Alginate dressing or gauze packing. D. Hydrogel sheet. Answer: C. Alginate dressing or gauze packing. This question evaluates the LPN's knowledge of advanced wound care, specifically for deep, tunneling wounds. The keywords deep, tunneling wound indicate a wound that needs to be filled to prevent premature closure of the skin surface and to absorb exudate. Non-adherent gauze, transparent films, and hydrogel sheets are generally for superficial wounds, protecting skin, or providing moisture. Alginate dressings are highly absorbent and can be packed into deep wounds, forming a gel that conforms to the wound bed and absorbs exudate. Gauze packing also allows for filling and absorption. This process promotes healing from the inside out and prevents abscess formation. It's like filling a hole in the ground so that it can be built up from the bottom. Proper packing is essential for deep wounds. Question 23. An LPN is assisting with the care of a client diagnosed with diabetic ketoacidosis, DKA. The LPN reviews the client's laboratory results. Which finding is the LPN most likely to observe? A. Blood glucose 80 mg per deciliter. B. pH 7.48. C. Serum potassium 5.8 milliequivalent/L. D. Bicarbonate 28 milliequivalent/L. Answer: C. Serum potassium 5.8 milliequivalent/L. This question assesses the LPN's understanding of key laboratory findings in diabetic ketoacidosis, DKA. DKA is a severe complication of diabetes characterized by hyperglycemia, metabolic acidosis, and ketonuria. While the initial blood glucose will be high, and pH will be low, acidotic, and bicarbonate will be low, due to acidosis, a common and often paradoxical finding in DKA is hyperkalemia, high serum potassium, upon admission, even though the total body potassium might be depleted. The body shifts potassium out of cells in an attempt to buffer the acidosis. Therefore, a serum potassium of 5.8 milliequivalent/L is a likely and critical finding. Think of it like the body trying to fix one problem by creating another temporary one. While overall potassium is low, initially it can be high in the blood due to cellular shifts. Question 24. An LPN is assisting with the care of a client who underwent a total hip arthroplasty yesterday. The LPN notes the client is positioned with legs crossed. What is the priority action for the LPN to take? A. Document the finding in the client's chart. B. Reposition the client to maintain hip precautions. C. Notify the physical therapist about the client's positioning. D. Remind the client not to cross their legs. Answer: B. Reposition the client to maintain hip precautions. This question tests the LPN's immediate intervention skills in preventing a serious post-surgical complication. The keywords total hip arthroplasty and legs crossed immediately signal a violation of hip precautions. Crossing the legs significantly increases the risk of hip dislocation, a painful and serious complication. The priority action is to immediately reposition the client to correct the unsafe posture and prevent dislocation. While documenting, notifying the physical therapist, and reinforcing teaching are all important, preventing injury takes precedence. It's like seeing a child about to run into the street. Your first action is to pull them back to safety. Prevent potential harm by taking immediate action. Question 25. The LPN is caring for a client with a new peripherally inserted central catheter, PICC, line. Which observation during a dressing change should the LPN report immediately to the registered nurse, RN? A. Mild redness at the insertion site, smaller than a dime. B. Client complains of slight discomfort during the dressing change. C. Clear drainage present on the old dressing. D. Swelling and tenderness above the insertion site with warmth. Answer: D. Swelling and tenderness above the insertion site with warmth. This question evaluates the LPN's ability to identify signs of potential complications related to a central venous access device. The keywords PICC line and report immediately highlight the need to recognize a serious issue. Swelling, tenderness, and warmth above the insertion site are classic signs of phlebitis or a more severe infection/thrombosis related to the PICC line, which requires urgent assessment and intervention by the RN or healthcare provider to prevent further complications like sepsis. Mild redness, slight discomfort during the procedure, or clear drainage are generally less concerning and might be expected or minor findings. It's like finding a sudden, hot, and swollen area around a wound. It signals an immediate problem that needs professional attention. Always be vigilant for signs of infection or inflammation around central lines.